Late at night in the emergency room, the bright overhead lights flickered slightly as a young girl clutched her stomach in pain. She winced, her breath shaky, as her father gently held her hand. She was only 12, and the pain had come on suddenly, sharp and unbearable. Her father, a tall man in a crisp button-down shirt, tried to keep her calm, but there was an edge of worry in his eyes. He knew something was wrong. They had rushed here for help, expecting care, compassion, some relief, but what they got was something far worse. A nurse, stiff and impatient, stood by the desk, barely glancing at them as they arrived. She had seen them walk in, seen the fear in the girl's eyes, yet she didn't move. Instead, she sighed loudly, tapping at the computer as if their presence was an inconvenience. "You'll have to wait," she muttered without looking up. "We're busy." The father's jaw tightened. He knew the emergency room well, too well. But today, he was here as a worried parent, not as a doctor. He wasn't wearing his white coat, didn't have his badge on. He was just a dad trying to get help for his daughter. Still, something in the nurse's tone didn't sit right with him. Minutes dragged into nearly an hour, and the little girl's pain worsened. She curled up in the waiting room chair, a soft whimper escaping her lips. That's when her father stood. "She needs help now," he said firmly. The nurse finally looked up, her expression twisted with annoyance. "I told you, you have to wait," she snapped. Then, under her breath, she muttered something else. Something cruel. Something that made the father's hands clench into fists. He took a slow breath, trying to stay calm, but before he could say anything, the nurse did something shocking. She stepped forward, grabbed the girl's arm, and yanked her upright. "Stop making a scene," she hissed. "I've seen people like you fake pain for attention before." And then, before anyone could react, she shoved the girl back down. A gasp echoed through the room. The girl let out a cry, clutching her stomach, her face pale. The father's heart pounded. In that moment, something in him shifted. He was no longer just a worried dad. He was something more. And as the room fell silent, he reached into his pocket, pulled out his ID badge, and let it drop onto the counter. The words on it sent a chill through the air. *** Dr. Anthony Carter, Medical Director ***. The nurse's face drained of color. She had no idea who she had just put her hands on. And now she was about to find out. The nurse's eyes darted to the badge on the counter, and for the first time that night, she looked truly nervous. Her hands trembled slightly as she stepped back, her mouth opening as if she wanted to say something, but no words came out. The father didn't move. He just stood there, staring at her, his expression unreadable. The weight of the moment was thick in the air, pressing down on everyone in the room. The other staff at the front desk glanced at each other, suddenly aware of the shift in energy. A few of them knew exactly who Dr. Carter was. He wasn't just another doctor. He was the one who oversaw this entire hospital. The one who made sure everything ran smoothly. The one who, at this very moment, had the power to change everything for the woman standing in front of him. The nurse's throat bobbed as she swallowed hard. I didn't know," she stammered. "I was just following procedure." Dr. Carter's gaze didn't waver. "Is that what you call this?" His voice was low, controlled, but there was a dangerous edge to it. The little girl whimpered, shifting uncomfortably in the chair, and instantly, her father was back at her side. His entire demeanor softened as he knelt down, brushing a hand over her forehead. "I'm here, baby," he whispered. "I've got you." But even as he comforted her, his mind raced. He had worked in medicine for years, long enough to know when someone was being neglected. He had seen the way this nurse looked at them when they walked in, the way she dismissed his daughter's pain, the way she grabbed her like she was nothing more than a problem to deal with. He had spent his entire career fighting to make sure hospitals were places of healing, of fairness, of dignity. But now, standing here in this very hospital, watching his own child suffer under the care of someone who was supposed to help, he felt something he hadn't felt in a long time. Rage. The nurse took another step back, her face pale. "I didn't mean." A doctor in a white coat rushed over, glancing between them. "Dr. Carter." His voice was tight with concern. He had clearly just been filled in on what had happened. "I had no idea you were here. Please, let's get your daughter into a room immediately." Dr. Carter lifted his daughter into his arms, her body limp against him. "Now," he said sharply. As they hurried toward the treatment area, the nurse stood frozen in place, her breath coming in shallow gasps. She knew. This wasn't over, not even close. Dr. Carter carried his daughter through the hallway, his grip firm but gentle. He could feel the unsteady rise and fall of her breath against his chest. His mind raced, running through every possible diagnosis. Was it appendicitis? An internal infection? He needed answers, and he needed them fast. A nurse, one he actually trusted, opened the door to an exam room, and he carefully laid his daughter down on the bed. She blinked up at him, her face tired and pained, but she managed to squeeze his hand. "Daddy," she whispered. "I'm right here, sweetheart," he assured her, brushing her hair away from her face. Another doctor entered, this time someone Dr. Carter knew well, Dr. Patel, one of the hospital's top pediatricians. He quickly assessed the girl, his expression growing serious. "We need to run tests immediately," he said, signaling a nurse to prepare an IV. Dr. Carter nodded. He trusted Patel, but he also knew that his anger hadn't left him. It still burned under his skin. His daughter had suffered longer than she should have because of that nurse at the front desk. And for what? Because of a snap judgment, a bias that nearly cost his little girl proper medical care. As Patel worked, Dr. Carter stepped out into the hallway. He needed air. But as soon as he did, he spotted the same nurse lingering near the nurse's station, speaking in hushed tones with another staff member. The moment she saw him, she stiffened. He walked toward her slowly, his presence commanding but controlled. "You need to explain yourself," he said, his voice low. "Now." The nurse shifted uncomfortably, glancing at the others around her as if hoping for backup. But no one spoke. No one was willing to stand by her after what had happened. I just thought she was exaggerating," she admitted finally, her voice quiet. "People do that sometimes, and it's a busy night." Dr. Carter's hands clenched at his sides. "So you decided she wasn't worth your time?" He pressed. "You decided she didn't need care." The nurse flinched. "It wasn't like that." "Then tell me how it was," he demanded. "Because from where I'm standing, you ignored a sick child and then put your hands on her." She looked away, guilt flashing across her face, but before she could answer, a voice interrupted them. "Dr. Carter." A nurse from inside the exam room called out, "We have the test results." He turned sharply and rushed back inside, pushing his anger aside. Right now, his daughter came first. But one thing was clear, this wasn't over, not even close. Dr. Carter stepped back into the exam room, his heart pounding. His daughter lay still on the bed, her tiny frame swallowed by the crisp white sheets. Her eyes were half open, exhaustion and pain written all over her face. Dr. Patel stood by the monitor, scanning the test results, his expression unreadable. "What is it?" Dr. Carter asked, his voice tight. Patel hesitated for a second before turning the screen toward him. "It's her appendix," he said. "It's severely inflamed. We need to get her into surgery immediately." For a moment, everything seemed to freeze. Dr. Carter felt a wave of emotions: fear, anger, relief that they had caught it in time, and frustration that they could have caught it sooner. If they had been seen right away, if his daughter had been treated the moment they arrived, she wouldn't have suffered this long. "We're prepping the ore now," Patel continued. "She's in good hands, but we can't wait any longer." Dr. Carter moved to his daughter's side, gently holding her hand. "Baby, we're going to fix this, okay?" he said softly. She gave him a weak nod, her fingers barely squeezing his. The room filled with the sound of hurried movement, nurses preparing medications, a tech setting up an IV. The urgency was clear now, but it was hard to ignore the fact that this urgency should have been there from the start. As they wheeled his daughter toward the operating room, Dr. Carter followed closely, his mind racing. But just before they turned the corner, he caught a glimpse of the nurse, the one who had ignored them, standing near the station, her face pale. He stopped. His daughter needed him, but so did something else. Justice. He turned toward Patel. "I'll be scrubbing in," he said. "But before I do, I need a word with hospital administration." Patel gave him a knowing nod. "I'll make sure she's prepped. Go." Dr. Carter's steps were quick, his mind set. He stormed down the hall, each moment replaying in his head the dismissive tone, the cruel words, the moment that nurse had put her hands on his child. This wasn't just about his daughter. How many other patients had been ignored? How many families had been turned away, unheard? As he pushed open the doors to the administrative office, he knew one thing for sure. This hospital was about to change. And that nurse, she was about to face consequences she never saw coming. Dr. Carter pushed through the doors of the administrative office, his presence commanding attention. The hospital director, Mr. Reynolds, looked up from his desk, startled by the sudden entrance. He wasn't used to seeing Dr. Carter like this, furious, determined, unshaken. "We need to talk," Dr. Carter said, his voice firm but controlled. Mr. Reynolds sighed, setting down his pen. "I heard there was an incident," he admitted, already looking uneasy. "Dr. Carter, I understand your frustration, but let's handle this carefully." Dr. Carter leaned forward, planting his hands on the desk. "No, we're not brushing this under the rug. A nurse in this hospital dismissed a child in pain. She put her hands on my daughter. And as she did it to my child, imagine how many others she's done it to." Reynolds hesitated, then let out a slow breath. "We'll open an investigation." "That's not enough," Dr. Carter shot back. "I want her suspended immediately." Before Reynolds could respond, a sharp knock on the door interrupted them. A young nurse, wide-eyed and hesitant, stepped in. "Dr. Carter," she said quickly, "it's your daughter. Something's wrong." The room spun for a split second. Dr. Carter's heart slammed against his ribs. Without another word, he bolted past the nurse and down the hallway. When he reached the surgical prep area, he found Patel and another doctor hovering over his daughter. The steady beeping of monitors filled the room, but something was off. Patel turned, his face tense. "Her vitals are dropping," he said. "We need to move fast." Dr. Carter rushed to her side, his hands shaking as he touched her forehead. Her skin was clammy, her breathing shallow. The sight of her like this, so fragile, so helpless, sent panic clawing at his chest. "How did this happen?" he demanded. Patel glanced at the IV, then at the chart. His expression darkened. Something's not right. Dr. Carter followed his gaze. That's when he saw it. His daughter's IV bag had been tampered with. The medication dosage wasn't what it should have been. His pulse pounded in his ears. Someone had done this on purpose. He turned sharply, scanning the room. The staff looked just as shocked as he was, but deep in his gut, he knew this wasn't a mistake. Someone had tried to hurt his daughter. And now it wasn't just about negligence. It was something far worse. Something intentional. Dr. Carter clenched his fists. This hospital wasn't just broken, it was dangerous. And whoever was behind this, they had no idea what was coming for them. The air was thick with tension as Marcus stood in the dimly lit office, his heart pounding. He had spent weeks undercover in his own real estate company, watching, listening, and taking in everything. Now, standing before the very employees who had mistreated clients, cut corners, and disrespected the business he'd built from the ground up, he knew it was time to reveal the truth. A hush fell over the room as he removed his disguise. A simple suit swap and a pair of glasses had been enough to keep him unnoticed. Eyes widened, jaws dropped. Some employees shifted uncomfortably, while others looked frozen in place. "I've seen everything," Marcus said, his voice calm but firm. "The lies, the deception, the way some of you have treated people who trusted this company. And today, it ends." The guilty ones didn't even try to defend themselves. They knew. They had taken advantage of their positions, thinking no one was watching. But someone had been watching the whole time. Marcus turned to his assistant, who had been in on the plan from the start. "Their final checks will be processed today. Security will escort them out." As the dismissed employees gathered their things, a heavy silence filled the room. Some stormed out, others looked ashamed. But just when Marcus thought it was over, a voice from the back spoke up. "You think firing us will fix everything?" It was Greg, one of the senior managers, his smirk barely hiding his anger. "You don't know the half of it." Marcus studied him carefully. "Then tell me." Greg hesitated, then scoffed. "You'll find out soon enough." And with that, he walked out. The remaining employees sat in stunned silence. Marcus knew there was more to uncover, but for now, the biggest damage had been handled. He exhaled, knowing this was only the beginning. Dr. Carter took a deep breath, forcing himself to stay focused. His daughter needed him now more than ever. Pytel and the team worked quickly, flushing out the IV and stabilizing her vitals. The room was tense, but within minutes, her breathing evened out, her small body relaxing slightly. Relief flooded through him, but it was short-lived. Someone had done this. Someone inside this hospital had tried to harm his child. His hands tightened into fists as he turned to Pytel. "I need security to pull every record of who handled her medication," he said. "Now." Pytel nodded without hesitation and stepped out to make the call. Dr. Carter stayed by his daughter's side, his fingers brushing against her hand. Her eyes fluttered open, and she looked up at him, weak but aware. "Daddy," she whispered. "I'm here, sweetheart," he said softly. "You're safe now." Security arrived within minutes, reviewing footage and cross-checking records. The findings were clear. The same nurse who had dismissed them earlier had also accessed his daughter's medication. Dr. Carter felt his stomach tighten. It hadn't just been negligence. She had made a choice. A cruel, deliberate choice. Reynolds appeared at the door, his face grim. "She's being escorted off the premises," he confirmed, effective immediately. It wasn't enough. It would never be enough, but it was a start. As Dr. Carter looked down at his daughter, he knew this was bigger than just one nurse. This was about every patient who had ever been overlooked, mistreated, or ignored, and he wasn't going to let it continue. Days later, as his daughter rested safely at home, Dr. Carter stood before the hospital board, pushing for new policies, stricter oversight, and better training. He wasn't just speaking as the medical director, he was speaking as a father. Because no one, no matter who they were, should ever be made to feel like their pain doesn't matter. And as he left that meeting, one thing was certain: change was coming. And this time, no one could ignore it.